Good afternoon, my name is Aura Soto and I'm doing the video today for Unit 5, Surgical Procedures. And my video today is going to be on the knee arthroscopy. Okay, there we go. This is my table, my sterile table that I have. And as you can see, I have all my setup in here. It was a little hard for me to find the different instruments that I needed for this surgery. I have my gloves on, and of course I have my boots or my shoes cover on too. It was a little hard for me to find all the instruments for this surgery, and so I ended up making a lot of copies and then just having a few instruments or a few items that I needed for this surgery out. Okay, I'll continue talking. Okay, so first, once we have all the instruments set up at the table, and the back table too, we prepare the patient. The patient is already consent, and then is given anesthesia, and then the surgical tech gets the patient all draped, and they use the ionize to prep the patient or to clean the patient and the area that the surgery is going to happen, and then you drape the patient down. Okay, I have everything that I need for that. I also have 4 towels because you're going to need them for the procedure. Okay, and this is the procedure that we're going to be talking today. Okay, arthroscopy. I also have my little bag for to drop everything that is not used or needed during the procedure if we have to put it in here. Okay, the surgery consists of having a scope, and so I printed the scope, which is the arthroscope. And I'm sorry, I know this is a little you can barely see it, but you use for this procedure you will be using the scope here, and then with this scope you have different equipment that it gets or brings along that you have to use for different purpose. We have the grasper reinforced set that has T, and that you put it through here. I also had another one in here. You put it through the scope, and then you also have the scissors. You have the punch if you need to make any biopsy or any any punch biopsy. You also have the punch forceps. In the same thing, you have the shape knife, and there's a knife too right in here. Okay, so it has all of the equipment that you need to do this arthroscopy. Okay, you have the rosette knife right here, rosette knives, the curated, you also have it right in there, and then the meniscus knife, because you're gonna need it for that area since it's a very tiny little area that you're going in. You're gonna need that, and you also have the cup shape curated. So that also goes right inside, and the scope. The scope setup is you have your scope right here. You have the different scope that you need. You have your knife, because in order for you to insert the scope inside, you need to make a little incision, and so you have your knife in here, which I have it right in here. Okay, so you will use that with either it says with a 7, a 3, or a 3 blade. Okay, and so we have the different equipments right here, the different scope that you're gonna use to get the sample or the biopsy or to the procedures. Right in here we also have the Mayo scissor, we have the measurement scissor, we have the Edson pickups without T, syringes, because we need to inflate the area with fluid, normal saline. And then we have the grasper right here where you're gonna place it to keep the knee still, not to be able to move. And then we have right here we have the other instruments that we're gonna need throughout the whole procedures. We have the pickups in here, the awesome pickups, which is this one right here, okay. We also have the, where are we going? Oh my god, I got lost here. We also have the core weight lander. Okay, sorry about that. The weight lander, we're also gonna use that to open the small incision, so that kind of opens up, and then the surgeon will be able to insert the scope in there. Okay, and with that they will use this to kind of find the spot. Okay, for after we have the needle holder, and the needle holder will use it to suture the little incision, the little 4 incisions that are gonna be made on the knee. And then we also have the nail scissors just to cut the sutures off after that. Pretty much you have everything that you need. It's not a lot. Most of the stuff that you need in there are like the scope and everything that you need to put in the scope. Like I say, the grasping forceps with T, the grasping forceps without T. You're gonna need the punch forceps with a wide head, and then you're gonna need the punch forceps straight, and that goes all at once inside the scope. And then you're gonna need also the scissor with the little hook. Okay, and that's another one that is like very mini, very tiny one too. And the punch biopsy or the punch forceps, you are gonna need that too, and that also comes in the set. There's also like a line grasp. If you do any stitches inside, you're gonna use the line grasp to grab it. And there's a retractor tool for the punch on the left, and a retrograde punch for the left also. Okay, I also have my little rate tag here because we know we're gonna use them for the procedures. I have my little container here where all the different knife or blades, I'm sorry, are gonna go. Okay, I grab my non-penetrating towel clips because we're gonna use this to cover or to protect or to maintain the towels and the draping in place for the patient. I think I got everything today. I hope I did good. Thank you.